Okay, so today we're going to be doing a head-to-toe assessment. So I'm going to start off by asking you if you know where you're at.
Yes, I'm at the clinic.
Do you know today's date?
November 23rd, 2019.
Okay, good. So I'm going to start with your eyes. If I put this paper in front of you, can you read what the top line says?
Your bladder health is important.
Okay, good. So I'm going to take a look at your eyes. Just look straight ahead for me. Okay, so your pupils are about a 4. I'm going to shine a light in your eye briefly. Okay, so your pupils are round, equal, and they react to light. Can you follow my pen with just your eyes? Can you look at the ceiling? Okay, can you look at my pen? Okay, good. Do you have any problems with your vision? Have you ever experienced blurry vision? Any difficulties reading?
No, but one time there was, I was driving at, I think it was early in the morning or late at night, and the lights were like very blurry, but that only happened like one time, and after that, that was it.
Okay, so no other problems. Have you ever had your eyes checked at the eye doctor?
Yes.
Okay, so it's important to do that once a year just to make sure your eyes are doing okay, because as we age, everything ages, especially our eyes, because we use those every day to look, to read, and all the above. Can you smile for me? Can you raise your eyebrows? Can you puff your cheeks? Can you hear this? Can you raise your shoulders? Can you squeeze my fingers? Because everything appears to be equal. I don't see any weaknesses going on. Do you have any allergies?
No.
No allergies to medicine, to shellfish? Okay, that's good. So I'm just gonna take a look at your chest to make sure that it looks even. Okay, so your respirations are even unlabored, and they're an 18, so that's normal, that's good. Have you had any problems with your respiratory system? Any breathing problems, any shortness of breath, any upper respiratory problems, allergies, seasonal allergies, stuffy nose?
No.
Okay, so none of that? No asthma?
No.
Okay. So I'm going to take a listen to your lungs. So if you could just sit up and look towards that wall for me, please. So just take a deep breath in and out with your mouth open. Okay, so your lungs sound even and clear. I'm going to take a listen to your heart. Can you hold your breath? So I can hear the S1 and S2 sounds. I don't hear any heart murmurs. Before we continue, can you say ah and stick your tongue out for me? Can you move your tongue from side to side? Okay, good. No deficits. Have you had any problems with your heart? Any history of heart problems?
When I was 14, I had a heart cath done. I had a heart murmur, and they said I had a hole in my heart, so they put a device in place.
Okay. So that's been a few years. Have you had any problems with that?
No,
Have you kept up with your cardiologist?
not lately.
Okay, so just want to make sure that you visit your cardiologist at least once every year, depending on what they say, to make sure that, because you had that procedure done, to make sure that it's functioning properly and that it keeps functioning properly as the years go by. So you want to stay up to date with that and be in touch with your cardiologist. Can you put your hands out for me? So I'm going to feel for your pulses. Okay, so they feel even. They're both strong. Your skin is warm, dry. Skin turgor is good. Capillary refill is less than 3 seconds. Now I'm going to feel for your pedal pulses. Okay, they're right here and they're both strong and even. Okay, I'm not seeing any swelling going on. Have you ever felt numbness or tingling in your arms or your legs?
Yes, sometimes when I get my blood pressure taken, my hand will go completely numb. But besides that, my feet sometimes fall asleep and my hands all feel like tingling in them.
How often does this happen?
I would say probably at least once a day.
For how long has this been going on?
About 2-3 months now.
What are you doing now that you weren't doing 2 to 3 months ago?
I just changed birth controls, but I haven't taken any medication or anything else differently.
What kind of birth control are you on now?
The pill.
Okay. So the pill, like as every other birth control or any other medication, there's side effects to them. And the pill is known to affect the circulatory system, so your blood, it can cause blood clots. So you want to make sure that you let your provider know that you're feeling this numbness, your extremities are falling asleep, your legs, your arms, so they're aware of what's going on, and if there's a need for a change to be made, they should know about it, just to be on the safe side, because we want to prevent any damage to your bloodstream. So I didn't see any swelling, so that's good. Can you slide down so I can take a look at your abdomen? So from here I can see that your abdomen's flat. There's no bulging, no protruding. So I'm going to take a listen. Okay, so you have bowel sounds in all 4 quadrants. Any pain?
No.
Okay. When was your last bowel movement?
This morning.
Are you pretty regular when it comes to moving your bowels?
Yeah.
No difficulty, no problems with constipation, diarrhea? Do you have any problems with your stomach, heartburn, acid reflux?
No.
Okay. So your stomach's doing pretty good then. Any nausea, any vomiting?
No.
Okay. How would you say your diet is?
Well, I don't eat any red meat. I usually am pretty busy throughout the day, so I'll eat like smaller snacks instead of like bigger meals. I eat like maybe meat, like white meat, like chicken or fish, maybe 2-3 times a week. But I usually don't eat anything heavy.
How about vegetables and fruits?
I do eat vegetables and fruits. I wouldn't say every single day, but I try to eat them as often as
Okay, so
possible.
you would say you have a pretty healthy diet. How about water?
Yeah, I try to drink as much water as I can.
Do you drink juices, sodas?
Juice is not really sodas.
Any history of alcohol intake?
No.
Okay. What can you tell me about your bladder health?
Well, I've had UTIs in the past, but right now, like recently I haven't, but since I had my first UTI, after that they just kind of were recurrent, so like they would come and go. And if I don't drink enough water in the day, or if my diet is like more unhealthy, then I'll kind of feel it coming. Like I'll start to feel uncomfortableness, or like I feel like my bladder isn't fully empty. But I just try to drink as much water to try to like flush everything out so that I won't get it.
So you have a history of UTIs then? For the past how many years did you say?
About 4 years.
Okay. So since you have a history of UTI problems, I have a handout for you about bladder health. So women are the ones who are more likely to get bladder infections. That's due to the female urinary tract being a lot shorter than the male tract. So it makes it very easy for bacteria to get in there and cause problems. So there's some things that we want to do to be able to prevent this from happening. Drink lots of fluids. That washes out your system. It keeps you from getting dehydrated also, because sometimes you'll see UTIs with dehydration. So you also want to make sure you're always emptying out your bladder when you feel the urge to do so. I know sometimes we get busy and we want to put it off, but I recommend you not do that, because the more you hold your urine, the more your bladder expands. The way the bladder was formed, it is made to stretch, and it will stretch and stretch and stretch. The more urine you're holding, the more it's going to stretch. And that creates a problem, because then the bladder cannot return back to its original size even after you have already gone to empty it. There will be some retention in there, and that could also lead to recurrent UTIs. Cranberry pills are good to prevent them. They will not treat a urinary tract infection, but it can prevent them. Wiping from front to back, no questions asked, and flushing your bladder, going to urinate after intercourse. It's very important. Also, you want to make sure you know the signs and symptoms of UTIs, which you, as having recurrent UTIs, you already know. The increased need to go empty your bladder, having to urinate more often, not properly emptying your bladder, burning sensation when you urinate, sometimes pain in the lower abdomen. And so you want to make sure you tell your provider when you have these symptoms, so that they can get you on the right treatment of antibiotics to treat it. Because if a UTI goes untreated, it can transfer up into your kidneys, then creating a problem of upper urinary tract infection. And the kidneys are very sensitive, and it could cause a kidney injury to them. So you want to be careful and treat UTIs, prevent UTIs. So that information is for you. So if you can sit up for me and face that wall. And you said you haven't had a UTI lately, right?